Eunoia, A Blueprint for a Planet in Harmony, 2nd edition, Expanded Vision, Initiative 6, Healing the World, a New Model of Global Healthcare. In a world where the human body is universal, the fact that healthcare is still a privilege rather than a right speaks volumes. Not about medicine, but about the systems we've built around it. The Eunoia initiative does not aim to reform the existing global healthcare system. It aims to render it obsolete. For those, it has failed. We do not ask for permission from private insurance giants, pharmaceutical monopolies, or for-profit hospital networks. We are not disrupting their markets. We are bypassing them. We are weaving a parallel system rooted in earth and care, designed to catch the people who have fallen through the cracks. At its heart, this system will live within eco-villages, restorative human settlements where people live sustainably, rebuild the land, and support one another. But within those homes, a new model of care will grow, one where health is not a commodity, but a birthright. A web of care, not a pyramid of power. Healthcare under Eunoia is not designed as a pyramid with power, expertise, and profit concentrated at the top. It is a web where each node, each eco-village, each caregiver, each citizen is supported by the whole. Eunoia becomes a global structure that does what no government, no corporation, and no treaty ever has. Provides health security beyond borders. How? Universal access. Anyone accepted into a Eunoia eco-village receives full access to healthcare regardless of nation, income, or status. Decentralized delivery. Clinics are embedded in the community, mobile where needed, permanent where possible, staffed by locally trained nurses, paramedics, midwives, herbalists, and general physicians. Community governed. Oversight comes from the village, not bureaucracies. Care is accountable to those it serves. Open source technology. Shared diagnostics, treatment protocols, and health records flow securely through decentralized, transparent systems owned by the people. Holistic models. Mental, physical, and spiritual health are addressed equally. Prevention is valued over intervention. Food, shelter, purpose, and connection are foundational care. Eunoia as global governance, a treaty of care. Unlike the United Nations or the World Health Organization, Eunoia doesn't rely on top-down enforcement. It works through invitation, demonstration, and alignment. Governments that support Eunoia's presence within their borders receive tangible benefits. New housing for their citizens, jobs and training through eco-village life, restoration of degraded lands, reduced strain on public health care, housing, and social welfare systems. It becomes a win-win for the people and the government seeking to stabilize their populations. As more countries allow Eunoia to operate, a global precedent is set. Other governments, seeing the benefits and the international support, feel pressure to follow, not through coercion, but through the simple power of a better idea proving itself. Not for everyone, but for everyone left behind. Eunoia does not aim to abolish private health care. Wealthy systems will continue to serve those who can afford them. That is not our concern. Our concern is the rest of humanity. The people in informal settlements, remote regions, overcrowded cities, and broken nations. The elders with no pensions, the young people with no prospects, the children born into systems that never planned for them. We build for them. We build with them. And in doing so, we build a future that is healing, not just healed.